My name is Rachel Delgado. I'm 33 years old, and for 10 years my family treated my nursing career like a placeholder job I'd eventually outgrow. My father once told a table full of relatives that I was still figuring out what I actually wanted to do, 4 years into my ICU career, with 2 specialty certifications on my badge. What none of them knew was that my training was about to matter more than any conversation we'd ever had about it. At 2:07 on a Tuesday morning, my phone rang, and by the time the sun came up, a neurologist neither of us had ever met was going to tell my family something none of them expected to hear. Her silent revenge stories. If you've ever had your work quietly ranked beneath someone else's at every family dinner, comment, "I've been there," below. This one's for you. I've worked in the intensive care unit at Regional Medical Center for 9 years, the last 5 of them as a charge nurse on night shift. It's not a job that lends itself to easy explanation at a dinner table. I don't perform surgeries. I don't have a corner office. I spend 12-hour shifts managing ventilators, titrating medications, and making the kind of split-second calls that most people never think about until they're the one in the bed. I chose nursing deliberately, not as a fallback, though my family has spent a decade acting like it was one. I'm not a dramatic person. I don't raise my voice at family gatherings. I've simply gotten very good, over the years, at absorbing comments about my career with a smile that doesn't reach my eyes, and going home afterward to cry about it alone, where nobody has to watch. I want to be clear that nursing was never a fallback for me, because that assumption has done more damage in my family than almost anything else. I turned down early acceptance into a pre-med track in college, deliberately, because I'd shadowed both physicians and nurses during a high school volunteer program and found myself drawn, specifically, to the sustained, hands-on presence nursing required. The 12 hours at a single bedside, watching a patient's condition in real time, rather than the more episodic involvement I saw from the attending physicians who rotated through. I told my college advisor, at 19, that I wanted to be the person who actually noticed when something changed at 3 a.m., not just the person who got called after it already had. I've never once regretted that choice. I have, many times, regretted how hard I had to work to defend it to my own family. I still remember my first code, 4 months into my career, a patient I'd only met that morning going into cardiac arrest during a routine post-op check. I remember the specific, narrowing focus that took over. No room left for anything except the compressions, the rhythm, the count in my head, and the strange, sobering relief afterward when the attending told me my early recognition had likely made the difference in that patient's outcome. I drove home that night shaking and called my mother from the parking lot, wanting, more than almost anything, to tell someone what had just happened. She asked, kindly enough, if I was okay, and then asked if I'd heard from David about his residency match yet. I told her I hadn't, and let the conversation move on. I didn't bring up the code again. I don't think she ever knew it happened. I should explain where the dismissiveness in my family actually started, because it didn't begin with me. My grandmother, Rose, was a nurse for 38 years, most of it on a labor and delivery floor in Cleveland. My father, Gary, grew up watching his own father refer to her work as just a job to keep busy, even while she was the one who kept their household running through 2 of his layoffs. I never got to ask Rose directly how that comment landed on her, because she passed when I was 16, not long after I first told her I wanted to become a nurse myself. She held my hand and said, "It's harder than anyone in this family will ever tell you, and more important than any of them understand. Do it anyway." I think about that conversation often, especially now. I only fully learned the scope of my grandmother's career after she passed, going through a box of old commendation letters my grandfather had never once mentioned. She'd trained a generation of newer nurses on that labor and delivery floor, been recognized twice by the hospital for exceptional patient outcomes, and had, according to one letter from a grateful patient, personally caught a complication during a delivery that a rotating resident had missed entirely. None of that made it into family conversation while she was alive. My grandfather referred to her 38-year career, more than once in my hearing, as Rose's little job at the hospital, a phrase I've never been able to fully forgive, even though he's been gone almost as long as she has. Rose told me a story, not long before she passed, about a night early in her career when she'd caught a newborn's breathing pattern change before any monitor had flagged it, and how the attending physician at the time had barely acknowledged it, moving on to the next task as though catching it had been unremarkable. "That baby's alive today because I was paying attention," she told me, "and nobody in that room ever said thank you, because nobody expected they'd need to." She wasn't bitter when she told me this. She said it the way you'd report a simple fact about weather. This is what the work is, and this is what going unacknowledged for it feels like, and you learn to carry both at once. I didn't understand, at 16, how directly I was about to inherit that exact lesson. My father spent 31 years as a structural engineer before retiring, and he's always measured worth in credentials, degrees, titles, the kind of achievements you can put on a business card. He's not a cruel man. I want to say that clearly, because it matters for everything that follows. He loves his family fiercely, in his own way, but he inherited his father's quiet hierarchy of what counts as real work, the same one that once diminished his own mother, and without ever consciously deciding to, he pointed it squarely at me for a decade. I remember, at 9 years old, bringing home a school project where we had to draw what we wanted to be when we grew up. I'd drawn myself in scrubs, and my father, looking at it over my shoulder, said, not unkindly but not thoughtfully either, "That's sweet, but you could aim higher than that, you know." I didn't understand, at 9, what higher meant in that sentence, only that whatever I'd drawn apparently wasn't it. I kept the drawing anyway, folded in a box of childhood things, and found it again the week after my father's stroke. An odd, quiet coincidence that I still haven't fully made sense of. I only met my father's father a handful of times before he passed when I was 7, but I remember one specific afternoon at his house, watching him ask David, who must have been about 9 at the time, already talking about wanting to be a doctor, a series of engaged, delighted questions about the human body, while I sat a few feet away with a book, unacknowledged. I don't think he meant it as cruelty. I think, looking back, he simply didn't have a category in his mind for a granddaughter's interests that didn't map onto something more serious, and nursing, when I mentioned it years later at Rose's kitchen table, would likely have received the same dismissiveness he'd once aimed at her career, had he lived to hear about it. My older brother, David, is an orthopedic surgeon, 35 years old, 6 years into a career my parents have never once had to defend at a dinner party. I want to be fair to David here. He never actively mocked me the way my father sometimes did. His role was quieter, the standard against which I was constantly, silently measured. Every family gathering, medical questions went to David by default, even ones about wound care or medication timing that were, frankly, closer to my daily expertise than his. Nobody in my family seemed to notice the pattern. I noticed it every single time. I remember one Christmas dinner in particular when a family friend asked David a general medical question about a knee replacement, entirely within his specialty, and he answered it thoughtfully for several minutes while the table listened, rapt. 10 minutes later, that same friend turned to me and asked, almost as a courtesy, "And how's work for you, Rachel? Still enjoying it?" A question with no room in it for an actual answer, phrased more like a check-in than genuine curiosity. David didn't cause that moment, but he sat inside a family structure that made it possible, over and over, without ever once redirecting attention my way himself. David and I were close as children, closer than most siblings 6 years apart usually manage. And I think part of what makes this story hard to tell is that the imbalance never came from any real coldness between us. We simply never talked, in any real depth, about the gap in how our parents treated our respective careers, because doing so would have required David to examine something he benefited from without asking for it, and would have required me to admit, out loud, how much it actually hurt. We took the easier path instead: pleasant holiday conversations, genuine affection, an entire decade of carefully avoiding the one subject that would have explained so much of the quiet distance underneath our closeness. I don't think any single comment from my family, on its own, would sound like much if I told you about it in isolation. My father, at my cousin's graduation party, introducing me as Rachel, she's in healthcare too. a phrase that always managed to make my job sound adjacent to David's, rather than its own demanding profession. My mother, Linda, gently suggesting more than once that I still had time to go back to school and really specialize in something. An aunt, at Thanksgiving, asking if I ever thought about becoming a physician's assistant instead, since you're so close already. Small, deniable, individually forgivable. 10 years of them stacked into something I stopped being able to ignore. The same year as that graduation party comment, I'd completed a demanding critical care specialty certification, a process that took over a year of study alongside full-time shift work, with a pass rate under 50% statewide. I mentioned it at a family dinner, briefly, expecting at least a passing acknowledgement. My mother said, "That's nice, honey," and asked David, in the very next breath, how his fellowship application was progressing. I didn't bring the certification up again after that. I put the physical certificate in a drawer at home instead of framing it, telling myself it didn't matter what my family thought. It took me a long time to admit that it did. I want to include one more specific comment because it's the one that, in hindsight, probably hurt the most, precisely because of how casually it was delivered. At my cousin's engagement party, an aunt I only saw a few times a year asked what I did for work, and when I told her, she said, brightly, "Oh, that's wonderful. My friend's daughter did that for a couple years before law school, too." I didn't correct her, didn't say that I had no plans for law school, that 9 years in wasn't a couple years before anything else. I just smiled and let the assumption stand, the way I'd learned to let so many assumptions stand, because correcting every single one, every single time, felt like a battle I didn't have the energy to keep fighting alone. Even my cousin Megan, David's age, once said something at a family barbecue that I've never fully shaken. "Must be nice having flexible hours though, right? Not as intense as what David does." I told her, as evenly as I could, that night shift ICU nursing wasn't exactly flexible, that I regularly worked holidays and had missed more family events than anyone at that barbecue realized because of it. She looked genuinely surprised, not defensive, just uninformed, and said, "Oh, I guess I never really thought about what your schedule actually looks like." That admission, "I never really thought about it," became, over the years, the sentence I heard some version of more than almost any other, delivered by well-meaning relatives who had simply never had a reason to wonder. There was a specific dinner, about 2 years ago, when I almost said something. My father was recounting, at length, a complication David had managed in surgery, genuine pride in his voice, and then turned to me and asked, offhandedly, "So what's new with you? Still doing the 12-hour shifts?" As if that were the whole of what I did. I remember the sentence rising in my throat, that I'd just led my unit through a mass casualty drill, that I'd recently gotten certified in a specialty most nurses in the state didn't have, and then swallowing it, because I'd learned, over the years, that correcting the record out loud only ever got me a slightly embarrassed laugh and a change of subject, never real recognition. Instead of correcting the record that night, I went home and told Tom the whole exchange, word for word, the way I usually did after these dinners. He listened, as he always did, and then asked a question that stuck with me longer than the dinner itself. "Why do you keep going back to these things, expecting a different outcome?" I didn't have a good answer. I think, if I'm honest, I kept hoping that eventually, if I was patient enough and accomplished enough for long enough, the recognition would simply arrive on its own, without my ever having to ask for it directly. 10 years is a long time to wait for something you could, in theory, just say out loud. I started seeing a therapist about a year before my father's stroke, mostly for general burnout, and I remember the session where the family dynamic came up almost by accident, in the middle of a conversation about something else entirely. My therapist asked, gently, why I'd never simply told my family, directly and specifically, how their comments landed. I gave her the same answer I'd given Tom, that I didn't want to make a scene, that it felt petty to complain about being underappreciated when nobody had done anything overtly cruel. She said something I've carried with me since. Petty is usually the word we use for a legitimate feeling we've decided isn't allowed to be loud. I didn't bring up the family pattern again in therapy after that. Not because it stopped mattering, but because I wasn't ready yet to do anything about what she'd named. I want to be fair to my own history here, because there was one earlier attempt I haven't mentioned yet. Back when I was 26, freshly certified, I did try to say something directly to my father at a birthday dinner, after a particularly pointed comment about settling. I told him, calmly, that I'd chosen nursing on purpose, that I found it meaningful, that I'd appreciate it if he stopped implying otherwise. He looked genuinely startled, apologized in the moment, and the conversation moved on within minutes. Nothing changed afterward. The comments resumed within weeks, just slightly softer around the edges. I think that early attempt is part of why I stopped trying again for so long. I'd learned, prematurely, that speaking up got me a temporary apology and no lasting shift, and I mistook that single data point for proof that speaking up simply didn't work. My closest friend at work, Monica Reyes, has covered more shifts with me than almost anyone else at Regional. She's the one who actually understood what my job required, because she lived it alongside me. The codes we'd run together, the families we'd sat with through the worst nights of their lives. One night, after a particularly brutal shift, I told her about the graduation party comment, and she said, without missing a beat, "Your family has literally never seen you work, Rachel. They have no idea what you actually do. That's not a reflection of your job. That's a reflection of their imagination." I laughed it off at the time. I've thought about that sentence many times since. I think of one shift in particular whenever I remember what Monica actually understood about my job that my family never did. We'd had a patient crash twice in one night, and Monica and I worked the second code together for 11 minutes before the patient stabilized. 11 minutes of decisions made in seconds, medications titrated by feel and training, no time to consult anyone above us because there wasn't time for anything except the two of us and what we already knew. Afterward, sitting in the break room at 4 a.m., neither of us said much. We didn't need to. That's the kind of understanding my family never had access to, because they'd never once seen what the job actually demanded when it mattered most. Tom and I have been together 5 years, engaged for the last one, and he's sat through more of these family dinners than anyone else outside my own household. He's an accountant, unglamorous by his own admission, and I think that's part of why he's always been able to see the pattern so clearly. He's never been on either side of the hierarchy my family quietly enforces. After one particularly rough Thanksgiving, he told me, "I don't think your dad even realizes he's doing it. That doesn't make it okay. But I don't think you're going to fix it by being quietly perfect at your job forever, hoping he notices on his own." I told him I didn't know what else to do. He didn't have an answer either, not yet. Tom has told me, a few times, about how differently his own family treats his work. His parents ask genuine, specific questions about his accounting cases, remember client names, follow up on outcomes months later. He didn't say it to rub it in. He said it because he genuinely couldn't understand why my family, who loved me just as much as his loved him, couldn't manage the same basic curiosity about how I actually spent 48 hours of every week. "It's not that hard," he told me once, gently. "You just have to actually want to know." I didn't have an answer for why my family didn't want to know. I still don't, entirely. Tom and I had a longer conversation, about 6 months before the stroke, about whether I should sit my father down directly and name the pattern, rather than continuing to absorb it dinner after dinner. I drafted, mentally, at least 3 different versions of that conversation, and never delivered any of them. Tom didn't push me to. He said, "It has to be your call and your timing. I just don't want you to look back in 10 years and realize you spent this many more of them staying quiet." I told him I understood. I didn't act on it. I want to be honest that this hesitation wasn't wisdom. It was fear, dressed up as patience, and I only fully recognized the difference once circumstances forced my hand for me. There was a stretch, about 3 years into my career, when the family dismissiveness nearly pushed me toward leaving critical care entirely for a less demanding specialty, something that might, I reasoned at the time, be easier to explain at a dinner table. I actually looked into transferring to an outpatient clinic role, less prestigious within nursing itself, but perhaps more legible to my family as real work. Tom was the one who talked me out of it, Not by arguing with my family's opinion, but by asking a simple question. Would you actually be happier doing that job? Or are you just trying to make your dad happier? I didn't have to think long about the answer. I stayed in the ICU. I've never regretted it. Even on the hardest nights. Even during the years when nobody at my family's table understood why I'd chosen to stay. The night it happened started like any other night shift for me. A full unit, 2 admissions in the first hour, the usual controlled chaos of critical care. My phone was in my locker, silenced, the way it always was during a shift. I didn't see it light up at 1:52 a.m. with a missed call from my mother. I didn't see the second one, from my father's phone, at 2:04. I found out about both only when I finally checked my phone during a brief lull, just after 2:15, and saw 3 missed calls and a voicemail that made my stomach drop before I'd even played it. Before my phone lit up with those missed calls, I want to mention what the first hour of that shift actually looked like, because it's part of why I hadn't checked my phone sooner. I had 2 new admissions within the first hour, a post-surgical patient requiring close monitoring, and an elderly man in respiratory distress who needed my full attention for almost 40 minutes straight. This is the part of the job my family never saw. The reason I hadn't answered on the first ring wasn't negligence. It was that I was, at that exact moment, doing precisely the kind of work they'd spent a decade treating as beneath serious conversation. For another family's father, a stranger to me, who needed it just as urgently as my own father would, an hour later. My mother's voice on the recording was shaking in a way I'd never heard from her. "Rachel, it's Dad. Something's wrong with his face. I don't know what to do. Please call me back." I called her back standing in the med room, heart pounding, and got her on the second ring. She was crying, barely coherent. I asked her, as calmly as my training let me, what exactly she was seeing. There's a specific, small detail from those minutes I've never fully described, even to Tom. Standing in the med room, thumb hovering over my mother's name on the screen, I remember feeling a strange, split-second flash of the old, familiar reflex, a fear that whatever I was about to hear would somehow get filtered, later, through the same dismissiveness that colored everything else. That even in an emergency, my read on the situation might not fully be trusted. It lasted less than a second. Then my training simply took over, the way it always does, and the reflex disappeared entirely under the weight of what actually needed to happen next. "His face looks wrong on one side," she said, "and he's talking strange, like the words aren't coming out right, and I don't know if I should just wait and see or—" I stopped her there, and I want to be honest that some part of my brain switched, instantly, from daughter to nurse, in a way that felt almost involuntary. "Mom, listen to me. Ask him to smile for you right now. Tell me what you see." A pause. One side isn't moving. "Rachel, what is this?" "Ask him to raise both arms and hold them there." Another pause. Longer, her breath catching. "He can't. His left arm keeps dropping." I told her, as steadily as I could manage, that this sounded like a stroke, that she needed to call 911 immediately, not drive him herself, and that she needed to note the exact time she'd first noticed his symptoms, because that timing would matter enormously to whatever hospital he ended up at. I want to explain, briefly, where the exact questions I asked my mother actually came from, because it wasn't instinct in the way people sometimes assume. It was years of specific, repeated training. The FAST assessment, face, arms, speech, time, is drilled into every ICU nurse from the earliest weeks of orientation, practiced on mannequins, tested on certification exams, reinforced during every stroke alert drill our unit ran. What looked, to my mother, like some kind of innate maternal instinct kicking in was actually the direct, traceable result of 9 years of a career my family had spent describing as something adjacent to real medicine. I think about that irony often, that the exact skill set they'd quietly diminished for a decade was the precise skill set that mattered most. In the one moment it counted more than anything else ever had. I stayed on the phone with her for the 7 minutes it took EMS to arrive, walking her through what to say to the dispatcher, reminding her twice to note the time again, telling her not to give him anything to eat or drink. Monica had noticed my face by then and quietly took over my patients without me having to ask. I remember standing in that hallway, phone pressed to my ear, feeling the strange doubled experience of being terrified for my father and completely clear-headed about exactly what needed to happen next, both at once. I want to give Monica her due here, because what she did that night mattered enormously and happened almost entirely without words. The moment she saw my face change, mid-shift, she took my patient assignments without asking a single question, simply saying, "Go. I've got it. Text me when you know something." She ran 2 units worth of patients, essentially alone for the rest of that shift, so I could be where I needed to be. I've thanked her many times since. She always waves it off the same way. "That's the job. You'd have done the same for me." She's right. I would have. It's a strange thing, loving a profession that colleagues understand instinctively and family members have spent a decade not bothering to. I clocked out the second my mother confirmed EMS had arrived and drove to Regional's emergency department, the same hospital I worked in, on the same campus where I'd spent 9 years of my career, arriving now not as staff but as family, a distinction that felt strange and disorienting as I walked through doors I usually badged through without thinking. I want to mention one small, specific detail about arriving at Regional that night, because it stayed with me. I was still in my work scrubs, badge clipped to my chest, the same uniform I'd worn into that building thousands of times as staff. A security guard I recognized from years of night shifts nodded at me automatically as I badged through, on autopilot, before catching himself and asking, gently, "You okay tonight, Rachel? You don't look like you're clocking in." I told him my father was being brought in, and he said, quietly, "Go on, I've got it," waving me through faster than protocol technically allowed. It was a small kindness from someone who actually knew, firsthand, what my work looked like. The exact kind of recognition my own family had never quite managed to offer. Freely given by a man I saw for 30 seconds a night, a few times a week, for years. My mother was already in the family waiting area when I arrived, still shaking. My father had been taken straight back for imaging. The ambulance crew had called ahead, and I knew enough about stroke protocols to understand that speed, at this point, mattered more than almost anything else. I sat with my mother, held her hand, and didn't tell her yet how much the next 20 minutes might determine. The 20 minutes I sat with my mother in that waiting area felt endless, and I want to describe them honestly rather than skipping past them, because they were some of the strangest minutes of my life, sitting in scrubs I hadn't had time to change out of, in a hospital where I badged in daily as staff, now completely powerless in the specific way family members always are, no matter what they know professionally. My mother kept asking me small, repetitive questions. Is this normal, this long? Why haven't they told us anything yet? And I answered each one as gently and honestly as I could, drawing on 9 years of experience to keep my own voice steady, even though inside, I was every bit as frightened as she was. I need to introduce someone here who I'd crossed paths with only twice before, both times briefly, on shared cases years apart. Dr. Priya Sharma, one of Regional's stroke neurologists, 15 years into a career built specifically around the exact kind of emergency my father was having. She had no idea, walking into that consultation room, that I was anything other than a frightened family member. She simply had a patient in front of her whose window for treatment depended entirely on how quickly the initial symptoms had been recognized and acted on. I'd actually worked one shared case with Dr. Sharma almost 3 years earlier, a patient of mine who'd developed sudden neurological symptoms mid-shift. I remembered her as sharp, unhurried, exactly the kind of specialist you wanted making decisions in a crisis. I hadn't expected, walking into that consultation room as a daughter rather than a colleague, that she'd be the one meeting my father. It felt, in a strange way, like the 2 separate halves of my life. The professional one my family had never bothered to understand, and the personal one now in crisis, were suddenly occupying the exact same small room, with no way to keep them apart anymore. Those first 40 minutes waiting for Dr. Sharma to come back out were, without exaggeration, the longest of my entire career, professional or personal. I knew enough about stroke protocols to understand roughly what was happening behind those doors. The imaging, the assessment of whether TPA was appropriate, the narrow, unforgiving window that made every one of those minutes count double. Knowing exactly what was happening didn't make the waiting easier. If anything, it made it harder, because unlike my mother, I understood precisely how much could still go wrong and had to sit with that knowledge in silence so as not to frighten her further. Dr. Sharma came out to speak with us about 40 minutes after my father arrived, calm and precise in the way I recognized from my own work. The specific, unhurried clarity of someone who has learned that panic doesn't help anyone in a moment like this. "Your husband's had an ischemic stroke," she told my mother. "But here's the important part. Whoever recognized the symptoms and got him here called it almost exactly right on timing. We were able to administer TPA well within the window, which makes an enormous difference in his likely recovery." She looked between my mother and me. "Do either of you know medicine? Whoever walked your mother through those first checks over the phone probably saved him from a much more serious outcome." Partway through the conversation, Dr. Sharma paused and looked at me more closely. "Wait, Rachel Delgado, ICU, regional, right? We worked a case together a few years back, the delayed presentation with the subdural." I confirmed it. A little startled, she remembered. She smiled, briefly, in the middle of an otherwise heavy conversation. "That explains the fast assessment then. You did that textbook, over the phone, at 2 in the morning, half asleep." "That's genuinely impressive." My mother, standing beside me, went very quiet at that, absorbing a version of my professional reputation she'd apparently never once heard described by anyone before. My mother turned to look at me, and I watched understanding move across her face slowly, like a tide coming in. "That was you," she said. "On the phone. The face, the arms, that was you telling me what to check." I told her yes, that I'd recognized the symptoms the moment she described them, that the timing she'd noted for EMS had been exactly what the ER team needed. Dr. Sharma, still standing there, added, without any idea of the weight the comment carried, "That kind of recognition in the first few minutes is honestly the single biggest factor in outcomes like this. Whoever taught you that should know it mattered enormously tonight." I stepped away for a moment after Dr. Sharma left and texted Monica, still not fully able to process what had just happened. "Dad had a stroke. I caught it on the phone. Dr. Sharma just told my mom it made the difference. I don't even know how to feel right now." Monica called me back within a minute, and the first thing she said was, "I'm so sorry about your dad, and I'm also going to say this gently. I hope some part of you gets to actually feel proud of yourself tonight too, not just relieved." I hadn't let myself think about it that way yet. Standing in that hospital corridor, I finally did, just for a moment, before going back in to sit with my family. In the hours after Dr. Sharma's update, I noticed my mother doing something I'd never seen her do before, quietly correcting other people's assumptions on my behalf, without my asking her to. When a nurse doing intake paperwork asked, casually, what I did for work, my mother answered before I could, saying, "She's a critical care nurse. She's the reason we're not having a very different conversation right now." It was such a small moment, easy to miss if I hadn't been listening for exactly that kind of shift. But it was the first time in 10 years I'd heard my mother describe my job to a stranger with anything resembling pride in her voice, and I let myself sit with it for a moment before saying anything at all. They led us back to see him briefly once he was stabilized. His speech was still slightly slurred, the left side of his face not fully cooperating yet, but he was alert, and when he saw me, he reached for my hand with his working one and said, slowly, deliberately, "Your mother said, you knew exactly what to do." I told him I did, that it was, quite literally, my job. He was quiet for a moment, working through the sentence in a mouth that wasn't fully listening to him yet, and then said, I didn't understand what that job actually was. I'm sorry, Rachel. It wasn't eloquent. Given the circumstances, it didn't need to be." A few days into his recovery, once his speech had improved enough for longer conversations, my father brought it up again, more fully this time. "I've been lying here thinking about that drawing you made, the one in Scrubs," he said, which surprised me, since I hadn't mentioned finding it. "Your mother found it in a box a few years back and showed me. I remember what I said to you about it. I've regretted that more than almost anything, this week especially. I told him I still had the drawing. He asked, quietly, if I'd consider framing it. I told him I would, and I have. It hangs in my hallway now, a strange, small monument to a decade I'm glad is finally behind us. A week later, once he was home and steadier, I finally told my father something I'd never said out loud before, not in 10 years. I told him that I hadn't needed him to understand every detail of my job, that I hadn't even needed him to be impressed by it. I just needed him to ask, once in a while, the way he asked David, a real question, with room in it for a real answer. He was quiet for a long moment, and then said, "I don't think I ever once did that, did I?" I told him he hadn't. Not really. He nodded slowly, and the next Sunday, he called just to ask what a shift on my unit actually looked like, start to finish. I walked him through it for almost 20 minutes. He didn't interrupt once. My brother arrived a few hours later, having driven in from 3 hours away the moment my mother called him. I want to describe his reaction carefully because it was different from what I expected. He didn't get defensive. He sat with me in the family lounge, still in yesterday's clothes, and said quietly, "I've spent 6 years assuming that because I have doctor in my title, I'm the one who'd know what to do in a medical emergency. I wouldn't have caught this. I don't even really know stroke protocol outside of what I learned in med school a decade ago. You knew it cold, at 2 in the morning, half asleep." I told him I appreciated him saying that. He looked at me for a long moment and said, "I think I've let this family believe something about you that was never true, and I never corrected it. I'm sorry for my part in that." David and I talked again a few weeks later, away from the hospital, over coffee near his practice. He told me he'd started, quietly, correcting people at his own work when they made assumptions about nursing being a stepping stone to real medicine, a habit he said he'd developed only since the stroke, prompted directly by that night. "I used to let comments like that slide because they didn't cost me anything," he admitted. "I didn't realize how much they were costing you. It wasn't a grand gesture, but it was David, in his own understated way, finally using his position at a hospital table to do the thing our father had never done for our grandmother, say, plainly, in front of colleagues, that the work mattered." My mother's reaction unfolded more slowly, over the following days, rather than in one clean moment. She stayed at the hospital with me for most of my father's admission, and somewhere on the second day, folding a blanket at his bedside, she said, without prompting, "I used to tell people you worked in healthcare, like it was some vague, adjacent thing. I don't think I ever once told anyone what you actually do, minute to minute. I don't think I understood it myself, until I watched you do it for him." I told her that meant more to me than she probably realized. She said quietly, "I know. That's kind of the problem, isn't it? My mother has told the story of that night to at least a dozen people since, and I've noticed, each time, that the way she tells it has changed. Early on, she'd say, 'Rachel happened to know what to look for.' More recently, I've heard her say, 'At a family gathering, my daughter's a critical care nurse. She caught his stroke over the phone. Before the ambulance even got there, they said it made all the difference.' The shift from 'happened to know' to 'she's a critical care nurse' felt small the first time I noticed it, and larger every time after. It was, I think, the specific correction 10 years of small comments had been waiting for. My sister-in-law, Elena, called me a few days after the stroke too, someone I'd always liked but never been especially close to. She told me she'd overheard David on the phone with a colleague, describing what happened, and said, "He kept saying, 'My sister, the nurse, caught it,' like it was the most obvious, natural thing in the world. I don't think I'd ever heard him introduce you by your job before, not like that." It was a small secondhand detail, relayed almost in passing, but it mattered to me more than I expected. Evidence, from someone with no reason to exaggerate, that the shift in how my family talked about me was real, and was happening even in rooms I wasn't in to witness it myself. A few weeks after the stroke, my mother asked to see the box of Rose's commendation letters I'd kept all these years. She sat at my kitchen table and read through them slowly, quietly, for almost an hour, and at one point she looked up and said, "I don't think I ever read these while she was alive. I don't think I ever asked to." I told her I understood, that I hadn't either, not fully, until after Rose was gone. My mother closed the box carefully and said, "I don't want to do the same thing with you. I don't want to be reading about what you actually did, after it's too late to say it to your face." It was, I think, the moment my mother's shift stopped being about the stroke specifically and became about something larger. A decision, made consciously, not to repeat a pattern she'd only just fully recognized. Monica told me something, not long after all of this, that I hadn't known about her before, despite years of friendship. Her own parents had immigrated to work factory jobs, and she said watching my family's slow reckoning had brought up something of her own. The years she'd spent translating for her parents at doctor's appointments as a teenager. Work nobody in her extended family had ever called anything more than helping out, even though it had, in its own way, shaped her entire career path toward medicine. I think a lot of us end up doing something we know matters, quietly, while the people around us decide whether it counts, she said. I'm glad yours finally decided it did. Not everyone gets that. I didn't have a response big enough for that comment. I just held on to it, the way I've held on to so much of what Monica has told me over the years, as one more piece of evidence that the people who actually understood the work had understood it all along. My father's recovery has been steady in the months since, some residual weakness on his left side, but his speech returned almost fully within weeks, and Dr. Sharma has been, by every measure, pleased with his progress. The change in my family has been slower and quieter than the recovery itself. My father asks me real questions now, about actual clinical situations, and listens to the answers instead of steering the conversation back to David. At a family dinner a few months later, when a cousin asked a medication question, my father said, before anyone else could answer, "Ask Rachel, she'd actually know," and I felt something loosen in my chest that had been tight for almost a decade. I finally took my critical care certification out of the drawer where it had sat for 2 years and had it framed, alongside the childhood drawing my father had asked about. They hang side by side in my hallway now, and my father, on a visit a few months after his discharge, stood in front of them for a long moment without saying anything. Then he said, "Your grandmother would have liked seeing those side by side." I told him I thought so too. It wasn't a grand reconciliation. It was quieter than that, and somehow more honest for being small. Tom was there for most of the aftermath, quietly present the way he'd always been, and I asked him once, a few weeks later, what it had been like watching my family's shift happen in real time. He thought about it for a while before answering. Honestly, a little frustrating, he admitted. Not because I'm not glad it happened. I am, but it shouldn't have taken your dad almost dying for them to actually see you. I'd been telling you that for years. I told him he was right, and that I understood, now, in a way I hadn't fully let myself before, how much I'd been protecting my family from the discomfort of hearing it directly, at my own expense, for far too long. I want to describe one specific dinner, about 4 months after my father's stroke, because it felt like the clearest marker of how much had actually shifted. It was an ordinary Sunday dinner, nothing special about the occasion, and a family friend asked a general question about managing a relative's blood pressure medication. Without any prompting, my father said, Rachel would know more about that than either of us, and turned the conversation toward me. I answered the question, and for the first time in a decade, nobody redirected the topic back to David afterward. It was such a small thing. I noticed it anyway, the way you notice the first warm day after a long winter. Not because it's dramatic, but because you'd almost forgotten what it felt like. Not long after that dinner, my mother and I talked, for the first time in years, about my grandmother Rose. My mother admitted she'd never really pushed back on my grandfather's dismissiveness while Rose was alive, partly out of respect for him, partly because it simply hadn't occurred to her, at the time, that there was anything worth pushing back on. I think I did the same thing to you, without meaning to, she said. I inherited it, the same way your dad did, and I never once stopped to ask whether it was actually fair. I told her I appreciated her saying it out loud. It was the first time anyone in my family had named the inheritance explicitly, rather than letting it live, unspoken, underneath every dinner table comment for a decade. I've thought a great deal, since that night, about why it took a 2 a.m. emergency to earn a decade's worth of overdue respect. I don't think my family ever set out to diminish what I do. I think they simply absorbed an old hierarchy. My grandfather's dismissiveness toward my grandmother's work, passed down quietly through my father, aimed at me without any of them fully realizing what they were repeating. It wasn't cruelty, it was inheritance. And I think the hardest part of untangling it wasn't the moment Dr. Sharma explained what had happened. It was realizing, afterward, that I had spent 10 years accepting a smaller version of my own worth because correcting the record, every single time, had felt like more of a fight than I had energy for. I've also come to understand something else, more slowly, in the months since. The people who diminish your work rarely do it because they've thought carefully about your work and concluded it's less important. They do it because they haven't thought about it at all, and an absence of curiosity can look, from the outside, indistinguishable from contempt. That distinction doesn't make the years of small comments hurt any less. But it does change what kind of correction you're actually hoping for. Not a grand apology for cruelty, but a genuine, if overdue, act of finally paying attention. I talked to Monica about all of this again, months later, once the dust had settled and I could see the shape of it more clearly. She asked me if I felt vindicated. I told her the honest answer was more complicated than that. That vindication implied a kind of triumph I didn't quite feel, mixed in as it was with the terror of almost losing my father, and the strange guilt of having something good come out of something so frightening. I don't think those feelings have to cancel each other out, she said. You're allowed to be scared for your dad, and also finally, quietly, be seen for what you've always been good at. Both things happened. You don't have to pick one. I've held on to that distinction since, the permission to feel more than one true thing at the same time, without needing them to resolve into something simpler. If your family has quietly ranked your work beneath someone else's for years, I'd tell you this: the correction doesn't have to come from an emergency. I got mine that way, and I'm grateful my father recovered well enough for it to become a turning point rather than a tragedy, but nobody should have to wait for a crisis to be taken seriously. Say what your work actually involves, plainly and specifically, the next time someone flattens it into something smaller. You don't need a neurologist standing in a hallway to grant you permission to say it. I just happened to get one anyway. I'd also say this, because it took me the better part of a decade to understand it myself. Correcting the record once, in the moment, costs you a small amount of discomfort. Letting the record stand uncorrected, year after year, costs you something much larger, even if it's harder to see accumulating in real time. I used to think staying quiet was the generous choice, the one that spared everyone an awkward moment at dinner. I don't think that anymore. I think staying quiet mostly just spared my family the discomfort of having to actually reckon with what they were doing, at my expense, and called it kindness because it was easier than calling it what it actually was. And if you're the parent, the sibling, the family member on the other side of this pattern, if you've ever found yourself automatically routing medical questions, or any other kind of expertise, toward the person with the more prestigious title, instead of the person who actually knows the answer, I'd ask you to notice how often that habit is really about the title, and how rarely it's actually about the knowledge. It's an easy thing to do without meaning any harm by it. It's also, I've learned, a very easy thing to correct, the moment you actually decide to. It's been just over a year now since that 2 a.m. phone call. My father's recovery has held steady. Dr. Sharma calls his outcome about as good as we could have hoped for, and he's back to most of his ordinary routines, with only occasional fatigue on his left side to remind him of that night. My relationship with my family has settled into something I genuinely didn't expect a year ago. Not a complete transformation, but a real, sustained shift in how my work gets discussed and acknowledged. My mother asks specific questions now and remembers the answers. David has started including me, unprompted, in family conversations about anyone's health, deferring to my expertise the way he once deferred only to his own. My father still occasionally slips into old habits. He introduced me at a neighbor's barbecue this summer as, "My daughter, she's in nursing," and then, catching himself mid-sentence, added, "She's actually one of the most experienced critical care nurses at Regional. Honestly, probably knows more than half the doctors there." It wasn't perfectly worded. It didn't need to be. Somewhere in the weeks after the stroke, in an attempt to process everything, I wrote a long letter to my father that I never actually sent. A full, honest accounting of 10 years of comments, the graduation party line, the still figuring out what she wants to do, the drawer where I'd hidden my certification for 2 years. I wrote it late one night, crying through most of it, and read it back the next morning, and decided not to send it. Not because it wasn't true, but because by then, he'd already started saying the things I'd needed to hear, in his own halting, imperfect way, and the letter would have reopened a wound that was already, slowly, closing on its own. I still have it, in a drawer, unsent. I think I keep it there as proof to myself that I finally wrote the truth down, even if he never had to read it in that particular form. There's one more small detail I want to include, because it feels like it belongs at the end of this, rather than buried somewhere in the middle. Years ago, not long after I became a nurse, I started writing a children's book about a girl who wanted to help people by paying close attention, rather than by being the loudest or most celebrated person in the room. I never finished it. Work took over, then the wedding planning, then the general exhaustion of defending a career choice at every family gathering left little energy for creative side projects. I found the unfinished draft again, in the same box as the childhood drawing, a few weeks after my father's stroke, and this past spring, for the first time in nearly a decade, I sat down and finished it. It's not for publication, it's just for me, and maybe someday, for a niece or nephew who needs to hear, early, that noticing quietly is its own kind of extraordinary. I don't think of my father as someone who ever meant to hurt me. I think of him as a man carrying an old, unexamined idea about whose work counts, one he inherited before he even knew he was carrying it, and one he's finally, slowly, putting down. My grandmother Rose never got the correction she deserved in her own lifetime. My father was still a young man when she passed, still years away from understanding what he owed her. I like to think some part of that debt got paid, quietly, in a hospital hallway 10 years into my own career, in a language she would have recognized instantly. Not an apology exactly, but a family finally understanding, out loud, what her kind of work had always actually required. I want to close with one more image before the final reflection, because I think it captures something the rest of the story only gestures at. That 9-year-old's crayon drawing, the one my father once looked at and said I should aim higher than, now hangs in a simple black frame in my hallway, beside my certification. Every so often, a visitor asks about it, and I've started telling the story plainly, without softening it. A father who once didn't understand what the drawing meant, and a decade later, finally did. I don't tell it for sympathy. I tell it because I think it's a useful, specific example of exactly how long these things can take, and exactly how ordinary the eventual correction usually looks once it finally arrives. Not fireworks, just a framed piece of paper, and a family that slowly learned to see it differently. I want to end with one more small thing about my grandmother, because I think it belongs here more than anywhere else in this story. A few months ago, I finally visited her grave with the framed certificate photograph in hand, an odd, slightly sentimental gesture I hadn't planned in advance. I stood there for a while, telling her, out loud, about the stroke, about Dr. Sharma, about the way my mother now reads commendation letters at my kitchen table instead of leaving them boxed and unread. I don't know if any of it reaches her, wherever she is. But I said it anyway, because she was the first person in this family who ever told me the work was worth doing, regardless of whether anyone else noticed, and I wanted her to be the first to know that, eventually, decades later, they finally did. If you've ever had your work quietly dismissed by the people who were supposed to be proudest of you, I'd love to hear how it happened, and what changed afterward. Let me know in the comments. And if this story meant something to you, consider subscribing. There are more stories like this one coming every week.